If you are a CNA, give yourself a round of applause. Because your job is not easy. It's your favorite 4'10" nurse. You said that. Nurse. Today's video, we're going to talk about why it is highly recommended that you should get the experience working in the early stages of the nursing field before becoming an RN. Big shout out to this comment here. If you have any more suggestions for my next video, please leave it in the comment section right below. Let's get into it. First starters, I am not an RN yet. I am currently an LVN, but in the future, I will be pursuing my RN license soon. Let's talk about CNAs and caregivers. Special shout out to the CNAs because they literally deal with so much, like literally and figuratively. I remember seeing the caregivers clean up a large poop and then they would literally clock out for lunch. That literally did not faze them. I have a special guest who will help me explain the different nursing positions. Shorty, can you explain the CNA position for them, please? Okay. Hey everybody, it's Shorty here. And first off, I'd like to explain how CNA and caregivers are the same. You could become a caregiver just starting off your work. Your work will basically train you into becoming a caregiver. For CNAs, you go to school and you are certified. But basically the work for the CNAs and caregivers, they both do the exact same patient care. So to explain what the CNAs do, they assist the patients with ADLs, which is activities of daily living. They bathe and help them get dressed. They feed them. They help them with toileting. They can measure vital signs, and they're able to transfer patients between their beds and to their wheelchairs. Okay, I'll be back. Okay, thanks. With this type of experience, you learn how to properly deal with different kind of patients and even their families. But be warned, you will have to clean up someone's poop and even give them a bath. If you're okay with that, then I will say it is a very... Do we just leave it off?
Just leave it off.
If you're okay with that, I will say it is a very rewarding feeling to be able to help take care of someone who isn't able to take care of themselves anymore. Forget about the background. There are some promotional opportunities. Some facilities may have a medication technician or med tech for short. The medication technicians are the ones that will administer the medications to the patients. To give you more insight, I started off as a caregiver at an assisted living facility. But after 3 months, I was promoted to a medication technician. It only took me 2 weeks of training and I also got a $1 raise. $1 raise is not that much. On the bright side, I didn't have to do CNA work anymore, but occasionally you would have to help once in a while. Working as a CNA and caregiver can be very stressful, especially if you're pursuing your nursing license. Now let's talk about the LVN position. Take it away, Shorty. Hey everybody, it's Shorty here. I'm back. As an LVN, you have more opportunities other than working at an assisted living or skilled facility. You can work at an allergy clinic and give allergy shots. You can work at a hospital and give flu shots. You can work at a fertility clinic, or if you are IV certified, you're able to give blood draws. I would recommend doing research and find what you want to do. In my opinion, this position is not as stressful as the CNA/caregiver position, but you still have to have patience, work long hours, and be the go-to person when an emergency situation happens. But you already knew about this when you watched my other video, right? Right? I'm kidding. Haha. Thanks for that. To tie it all up, yes, I highly recommend working as a caregiver, CNA, or an LVN before obtaining your RN license. You will gain experience and it may help you get a job faster than someone who does not have the same experience. Also, get that bag. As an LVN, not only will you gain experience, the money is really good. Of course, being an RN is a higher salary too, but why not pursue the bag while getting the bag? That makes sense, right? Try and get into the nursing field as early as you can. Get that experience. In the beginning, it may be a little hard and scary, especially if you have not had any experience dealing with any kind of direct patient care. But with some patients, you may be able to learn something new and you may be able to fill up your resume. So when you apply as an RN, your employers will be impressed. I hope this video was informative, so please do not forget to like and subscribe. See you in the next video. Bye!